Good day, Missoula County. Today's Friday, June 12th. I'm Ken Parks, acting IC for our county's COVID-19 response team. This afternoon, I'm going to update you with current local and state case counts and talk about how the virus is moving from cities to rural communities and how we can continue practicing safe behaviors to keep COVID-19 at bay. As of this morning, we have had a total of 41 cumulative positive cases to date in Missoula. 39 of those cases were identified by testing and 2 were epi-linked. We have had 40 recoveries and 1 death. We have no active cases in isolation currently. The state has a total of 573 cases, including 10 new cases confirmed this morning. New cases today are reported in Gallatin, Bighorn, Custer, Lake, and Lewis and Clark counties. This is Custer County's first COVID-19 case. The state DPHHS is reporting 66 active cases across Montana. In the past 3 weeks, we've seen COVID-19 moving from cities to rural communities across our country. This trend looks like it will continue. From the start of June, 14 U.S. states and Puerto Rico have recorded their highest ever 7-day average of new COVID-19 cases since the pandemic began. Additionally, hospitalizations due to COVID-19 or complications related to the coronavirus have also been on the rise in at least 9 states, including the Carolinas, Arkansas, Mississippi, Texas, Utah, Arizona, California, and Oregon. CDC data indicate that not only does the virus disproportionately affect people of color, older adults, and those with pre-existing chronic health conditions, but that those folks with pre-existing health conditions like chronic metabolic disease, hypertension or high blood pressure, obesity, and cardiovascular disease are disproportionately represented in hospitalization data. This indicates that when someone with a pre-existing health condition acquires COVID-19, it can be much more serious and sometimes life-threatening or life-ending. Hospitalizations are a key public health indicator. You might ask why. That's because those rates are not as dependent upon testing availability. Someone could end up in the hospital and then get tested for COVID-19. Because of this, epidemiologists report that hospitalizations are likely a lagging indicator of the virus's underlying reality, meaning that those hospitalization numbers provide a good sense of how COVID-19 trends are changing with time and with reopening. Every U.S. state has now reopened to some extent, with some non-essential business reopening and travel restrictions easing. Reopening means that people can start moving through the world in ways that feel a little more familiar, but while people are moving through the world with fewer restrictions, so too is the coronavirus. With fewer restrictions in place, COVID-19 can spread more easily, and we're starting to see the effects of reopening across the country and closer to home in Montana. While cases have remained flat in Missoula County, we're seeing that COVID-19 is currently affecting other parts of our states, with positive cases increasing in Yellowstone, Gallatin, and Lewis and Clark counties, to name a few. We're also seeing counties reporting their very first COVID-19 cases, like we saw in Custer County today. While an increase in cases tells us that COVID-19 is ever present, we also need to consider the transmission pathways of those new cases. Are they travel related? Are they connected to a known positive case? Or are they community spread, meaning positive case with no known connections to other positive cases? In Montana, we continue seeing that transmission pathways are diverse, with representation across all 3 of those pathway types. Some new cases are related to travel, and some new cases are connected to known positive cases. And some new cases are unrelated or not connected to a known positive case, meaning that COVID-19 is spreading through the community. Due to the general U.S. trend of COVID-19 moving from cities to the rural U.S., and due to the data we're seeing in our state, we must remain hopeful, but vigilant and diligent. For example, it is estimated that nearly 40% of COVID transmissions occur before someone feels or experiences symptoms. Wearing a face mask bolsters protection for those around you, your family, friends, and community, some of whom may have compromised immune systems or pre-existing health conditions, making them more susceptible to acquiring COVID-19 and experiencing more severe symptoms and outcomes from the virus. Early evidence from scientific droplet experiments indicates that a mask helps prevent droplets from reaching others. Behavioral changes like continuing to wear cloth face masks when 6 feet of distance cannot be maintained between non-household members, frequent and thorough hand washing, cleaning and sanitizing frequently touched surfaces, and so on, continue being critical and easy steps in keeping COVID-19 at bay. We've already seen data indicate that early closures and cloth face masks more than likely helped increase safety and keep case counts low while protecting our healthcare infrastructure. While reopening feels good and it feels normal, we need to continue with caution. A slow, intentional, phased reopening will allow public health and safety specialists the opportunity to observe data trends and thoughtfully and carefully respond to those trends. Let's continue supporting health and safety by doing our part. These safe behaviors are relatively easy asks and can go a long way toward keeping you and your loved ones safe. So have a beautiful weekend, be well, be safe, and take care of each other, Missoula. Thank you.